Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon. I specialize in facial rejuvenation, and today I'm going to talk about a very important and interesting topic, and that is myths in plastic surgery. There are so many of them out there. There's so much misconception and misunderstandings, but I'm going to take 10 of the most common ones and break it down so hopefully you will have a better understanding of what to believe and what not to believe. So without further ado, let's break it down. Myth number one, plastic surgery is for women only. Now, although the vast majority of plastic surgery is performed on women, approximately 15 to 20% of plastic surgery performed today are on men. And this is a growing segment of the population, and procedures that are super common among men are things like blepharoplasties, facelifts, liposuction, gynecomastia surgery, as well as hair transplants, and rhinoplasty actually. So this is definitely a growing segment of the population. So if you're watching this and you're a man, or if you have a husband or boyfriend who's interested in plastic surgery, let them know that they are definitely not alone. This is the fastest growing segment of the population. Myth number two, plastic surgery is always unnatural looking. All right, so this is a very important topic for me, especially. It's very near and dear to my heart, because one of the things that I believe in fundamentally is that good plastic surgery should never look like you've had plastic surgery. Is that too much to ask? I don't think so. You should simply look like yourself with the enhancements that are performed surgically, and as a result, be able to enjoy the heightened sense of confidence and self-image without wearing the stigma and screaming plastic surgery. Now, here's where it differs. Good plastic surgery is undetectable, is very natural looking. Bad plastic surgery leaves a very obvious look, and this is something that you can tell the minute you walk into a restaurant, the minute you walk into any type of environment. You're like, that person has had work done. We see this with some bad celebrity outcomes, etc. But let that be known that those are poorly performed, poorly technically done plastic surgery procedures that have that type of look. Good work is totally natural, leaves no sense of detection. Myth number three, plastic surgery is only for the rich and wealthy. All right, so maybe historically that was the case, but today, with so many increased number of procedures, procedure types, providers, and the overall increase in popularity, plastic surgery cuts across all socioeconomic levels. We see people from all different walks of life who are participating in plastic surgical procedures simply because they want to, like everyone else, look as good as they feel and enhance their sense of quality of life, etc. And there really is a surgeon and a procedure for everyone with all different types of income and socioeconomic levels. Now, having said that, don't let money be the only source of guidance, because the reality of the matter is you as an individual prospective patient want to make sure that you're being treated with the best way possible, with the best procedures that it can be done, so that your goals will be achieved and you look as good as you possibly can. And sometimes that doesn't always correlate with money in either direction. Some of the best procedures don't cost the most, and also some of the procedures that cost the least are not necessarily bad. So it's one of those things where you have to look at it carefully, individually, do your homework, do your research, and then let price be the final factor in the equation, but don't let that be the first. Myth number four, plastic surgery patients are all vain. Guys, I have been doing this for nearly 20 years, and I can't tell you how incorrect this is. People simply want to look their best because it feels good to look your best, to ward off the changes that are coming as a result of aging, which strip you of your natural look, that makes you look like a different person. I mean, aging fundamentally shifts our identity. Changes that are related to trauma, broken nose, genetic deformity, genetic changes in the face and the body, all these things that happen that affect us during our lives ultimately leave us not feeling as great as we could, and plastic surgery is the solution for those things. And it's very, very rare to have somebody who comes to us specifically for vanity, specifically because this is, just like an arbitrary decision. It cuts in a much more deep level emotionally, and that's really what plastic surgery is about. Myth number five, plastic surgery doesn't leave any scars. Now guys, I wish this was the case. I understand that it's inconvenient to have scars as a result of something that's supposed to improve your aesthetics, but anytime you cut the skin, you're gonna leave a scar. Now, most plastic surgery procedures use techniques that will lead to a very fine scar. They'll hide the scars in natural creases and shadows and areas that were hard to detect. But at the end of the day, if you cut the skin, you're gonna have a scar. And that's the trade-off of having surgery. But for most patients, for the changes that they get after surgery, it's a fair trade. Myth number 6, plastic surgery lasts forever. Although this would be great, very few situations in life, I would say none that I can think of, truly do last forever. And plastic surgery is no different from that. So changes related to facelifts, eyelid surgeries, liposuction, abdominoplasties, all those things do start to show some changes, some wear and tear over time. Now, most cases, for example, if you have a facelift done, the changes that are related to the facelift will last you your whole life. They don't just disappear and they don't just evaporate. They'll slow down the aging forever. So in many ways, you'll benefit from those changes forever, but you won't look the same way as you do on month 1 or 2, 10 to 20 years after the procedure. Myth number 7, all board certified plastic surgeons and facial plastic surgeons are the same. Guys, we all specialize in something completely different. We all have different passions, different interests, and as a result, our areas of expertise and our strengths are going to be different. Your job is to find a surgeon that has the area of expertise and specialty that you are interested in, not just the simple criteria they are a board certified plastic or facial plastic surgeon. That's simply not enough. Myth number 8, plastic surgery recovery is very painful. Now, there are certain procedures that are more uncomfortable than others. For example, abdominoplasty is generally the most uncomfortable type of procedure, but things like facelifts and rhinoplasties and liposuction, etc., generally can be a lot less uncomfortable than you expect, especially when many procedural modifications can be done at the time of surgery and postoperatively to really minimize postoperative discomfort and make the recovery as easy as possible. Myth number 9, you should wait until you're older to have surgery. This goes back to the fundamental reasons why you're having surgery in the first place. If you're interested in enhancing a region, restoring a region, for example, you have a sagging jawline and neck and you're in your late 40s and early 50s, and you're under the assumption that it's better just to wait till you're like in your late 60s or mid 60s to get it done, that is a big myth, and I'll tell you why. Because number 1, the outcomes actually turn out much better when you do it sooner rather than later. When the tissues haven't gone through, a lot of changes and then become attenuated and thinned, the outcome of the surgery is better, they last longer, you look more natural as a result. But more practically, if you're bothered by it today and you happen to be a little bit on the younger side of the spectrum, why wait until 10 years from now, 15 years from now, and just live with the thing that bothers you for all that time? This is my general recommendation and criteria. If it bothers you, there's something to address surgically, you're emotionally ready for it, then you're technically a candidate. Why not do it sooner than later? Enjoy the changes as long as possible. Myth number 10, cosmetic surgery and plastic surgery are the same. This is a bit of a semantic issue, but I want to be clear about something. Cosmetic procedures, in my mind, change what Mother Nature gave you. For example, cheek implants, chin implants, taking off a hump from the nose, breast augmentation, butt augmentation, those are changes that are cosmetic. They're fundamentally changing who you are. Plastic surgery can be much more subtle, can be much more restorative, reconstructive. So things, for example, like, in my opinion, facial rejuvenation, which is bringing your face back to where it was, that's restorative. It's not cosmetic. We're not changing who you are. We're simply bringing you back to where you are. Let's say you've had an accident, you bumped your nose and your nose has a hump on it. Well, that's, taking the bump down, that's restorative. Cancer reconstructive. So those are the fundamental differences between those two terms, plastic and cosmetic surgery. Now, they may seem semantic, they may kind of fall under one general umbrella, but understand that it is different in terms of what the scope and aim of the procedures are. That was a run through of 10 of the most common myths that people have about plastic surgery out there. Certainly not an exhaustive list, but definitely a list that hits on some of the most common ones. I hope it brought some more clarity. I'm happy to answer any questions. Drop them in the comments below. If you enjoyed this video, hit like and do me a favor, subscribe to this channel because I'm going to bring a lot more content like this and educational content as well as awesome before and afters and patient journeys your way. If you haven't had a chance, go peruse through our playlist and see what we've got out there. Send this along to friends and family to help them understand what's out there and debunking some of these myths, and ultimately follow me along because I'm going to bring more and more content your way. It's going to be fun, and look forward to the next one. Thanks, guys.